National Suicide Prevention Strategy is a document which was brought about by the Ministry of Health and Family Welfare, Government of India. This document is against the important public mental health issue that is suicide prevention, an important timely document for all of us to work upon. The strategy document is an attempt to create a framework to implement, as well as it is trying to set a stage to facilitate and coordinate. And this document emphasizes the role of multiple stakeholders in suicide prevention. So basically, suicide prevention is not just about one person's business, it's everyone's business as per this document. What is this single goal of this document? The goal of this document is to reduce suicide deaths in India by about 10% by the year 2030. Now, is it an achievable dream? 10% of suicide reduction by 2030. Is it possible in this next 7, 8 years which are left for us? Now, to give you understanding of what does this 10% suicide deaths mean, it's almost like a bus number of people per day to be prevented. Now that's about 50 odd people, right? That's the number of people whom you need to prevent every single day for you to achieve this 2030 goal of 10% reduction in suicide. By the way, about 1,60,000 to 65,000 suicides happen. So that's around 16,000 suicides you need to prevent per year, which can translate into about one bus of population to be prevented each single day. Quite an achievable, realistic target set by this team of suicide prevention strategy. Now, they also have gone ahead to talk about an approach by which we can implement and get this goal achieved. They have emphasized the role of multi-sectoral collaboration, and they've also spoken about how effective and sustainable action is needed. Action which doesn't remain once but should be effective and sustainable over a period of time. It emphasizes the factor of inclusiveness and innovation. Obviously, with a lot of technological growth and those, innovation becomes an extremely important area, and suicide prevention is an area where we need to look at inclusiveness and innovation to the core. There are three important objectives which are looked by this document. What are the three important objectives it looks at? One is an immediate objective. An immediate objective in the next 3 years. It wants to set up effective ways to keep track of suicides. We also know tracking is an important effective tool to manage any issue. So immediate goal is in the next 3 years is to first of all track the suicides. Second, intermediate objective is in the next 5 years to look into see how every district can provide basic mental health care support at least on outpatient basis. Now we know in India there are some states which have already achieved this significantly, but there are some states which are still lagging, so some work has to be done to achieve this intermediate goal. On the long term basis, in the next 8 years, they're looking at integrating mental well-being curriculum in all education institutions. If you look at these three objectives carefully, it has simple aspects of tracking the suicides to very ambitious level of taking mental health well-being curriculum to every educational institution possible. Now, what are they trying to do here is to not just see preventing suicides, but they're also looking at how can we help people cope much better or create a much better mentally healthy and well-being kind of a society. So it's a quite an ambitious goal which they are looking at. Hopefully, we should be able to achieve. The interesting part of this document is they don't just give this goal and objectives. They want to say a objective can be achieved through a path, right? The acronym they've used here is the REDS, REDS path. And they say this is an implementation mechanism which can be followed for you to achieve the particular goal which this document is looking at. Now, what is this REDS standing for? REDS standing for R stands for reinforcing, E is enhancing, D is developing, and S stands for strengthening. Now, what are we trying to reinforce here? We are trying to reinforce the leaderships, the partnerships, and institutions which are already doing some work which is significant out there in this area of suicide prevention. When you're talking about enhancing, we are trying to enhance the facilities of suicide prevention services which can be provided to the community at large at every grassroots level possible. And when you're talking about developing, we are trying to develop community resilience, and also create a support system in the community level, and definitely reduce the stigma about mental health and suicide issues in the community. Strengthening is trying to strengthen the whole surveillance system of suicide, and of course also understand how the evidence gets generated and implement the feedbacks out of the evidence which gets generated. So this is the reds path kind of an approach which will help us to achieve these three objectives. Going forward in this document, they have gone ahead to give 5 strategies for reinforcing, 5 strategies for enhancing, and 6 strategies for developing, and 2 strategies for strengthening. So basically, this document is not just giving you ideas, it is also saying the steps to be implemented and how to go about to achieve the goal. So that's the beauty of this document in a simple way. Now, if you're looking at the 5 strategies which they have emphasized to reinforce what? The leadership, the partnerships, and the institution capacity which is currently existing, is the strategies they've recommended are encouraging various groups to work together and reduce the stigma associated with mental health issues and suicide. That's number one strategy. Number two strategy is to focus on addressing the underlying psychosocial problems such as addiction at the policy level. We all know, if you're working in suicide prevention, addiction is a common issue and a confounding factor for increased rate of suicide. So we understand why policy level documentation about addiction prevention is important. Now, we need to advocate and reinforce advocacy of the inclusion of psychosocial treatment, part of every medical care system, not just psychiatric help. In any medical institution, it has to be implemented, and it has to be kind of combined with the regular care which is available at the grassroots level. We need to, the fourth strategy they emphasize is to push for responsible suicide reporting in media, because we know responsible suicide reporting can significantly reduce suicide rates in the country. Limiting ease of access is one of the most important strategies which has been emphasized. We also know even World Health Organization emphasizes on this strategy of limiting access as one of the very important preventive strategies, especially the poisonous pesticides and insecticides which are used by the farmers, right? If we can reduce the limit access to these lethal means, we could significantly reduce the suicide rates in the country. So these are 5 important strategies to reinforce at the leadership, partnership, and the institution capacity level. Talking about 5 strategies to enhance the capacity to provide suicide prevention services are they have asked for these 5 strategies to be implemented. Enhance resources for helping people cope with mental health and addiction issues. Again, the emphasis on addiction issues can be noted here. Integrating mental health services with general medical care. A lot of hospitals might not have mental health professionals on their panel at all. So that's something which we need to overcome and be able to provide mental health at every grassroots level possible. Increase the number of trained mental health professionals so that the people can be easily accessing trained mental health professionals for further help. Developing resources to aid people who are attempting suicides and surviving through, and even families who have gone through loved one suicide or issues of suicide happening in the family, because we know they also go through a lot of burden and stigma against them, and they need help too. Now, we need to offer support to those who have been diagnosed with substance dependent issues. If you're looking at this document, there is multiple times emphasis on substance use, and we know the reason, because substance use significantly affects mental health problems and, of course, suicide rates in the country. Now, what else has been mentioned here? Now, there are 6 strategies which have been given to develop community resilience and support and reduction of stigma against mental health and suicide. So basically, removing stigma and myths to encourage mental health help seeking. We know people don't seek mental health help. The mental health gap is about 75%. So that's a huge number of people who don't seek help. By reducing stigma and making people more aware of mental health services, maybe we can reduce the gap in this help seeking. The next strategy they have emphasized is enabling dissemination of knowledge. Exchange of ideas can greatly aid in preventing suicide. Promote mental health in schools and youth clubs. Also, Another strategy which they have emphasized is increasing efforts to prevent suicide among women. Now, expanding farmers' options of increasing output in the face of pesticide use restrictions are some interesting strategies which can be helpful. So, the last strategy which they've emphasized in developing is minimizing sources of stress at work. We do understand that these could be some of the potential challenges which can happen at the community level, right? These six strategies to develop could be extremely helpful so that the community can become more resilient and support people and reduce the rates of suicide in the community at large. With this understanding, there are two strategies which are given to strengthen the surveillance and the evidence generation system. Now, what are the two strategies they have spoken about in this document? Improving national and state reporting on self injury and other forms of harm. Now, improving that reporting system gets you better data, and better data helps you to plan better policies. Now, optimizing suicide data collection at national and state levels is extremely important. We need to understand with the changing technology and the changing epidemiology of mental health and the kind of population structure, we need to change the way we collect data, and useful data collection methods could help us to build resilient and useful policies for the future. So these two strategies could help us to strengthen surveillance as well as better evidence generation. Now, this is the overall gist of the National Suicide Prevention Strategy document which has been brought about. In simple terms, if you look at, they have emphasized two important aspects. Suicide prevention is everyone's business, is something which is very clear from this document. Not one person, one professional, or one agency can make a difference in suicide prevention. We all have to collaborate and work together, is something which is very clear from this document, which is speaking about. Now, they have come up with this goal of by 2030 reduce the suicide rates in India by about 10%. Now, I hope we realistically achieve not just 10%, even more than that, but it does look like a realistic goal we could look at trying to save. As I already mentioned, it's about one bus number of people being saved every single day. Quite an achievable target is what I think so. Now, we have heard of this statement, right? Well begin is half done. Now, this strategy document could be quite late, but still it's a good step forward in terms of suicide prevention strategy of the country. Before I conclude, I am reminded of Robert Frost's words. The woods are lovely, dark, and deep, but I have promises to keep, and miles to go before I sleep, and miles to go before I sleep. This is the time for all of us to join together, and work in the area of suicide prevention to make this world a better place. Thank you.